Hi, my name is Andrea Quispe. My topic is Cryptococcus Neoformans Meningoencephalitis. Definition. Definition. Cryptococcal meningoencephalitis. Meningitis is an infection and inflammation of the encephalon and meninges, which are the membranes that cover the brain and spinal cord. Meningitis can be caused by different germs, including bacteria, fungi, and virus. And a fungus called Neoformans causes most cases of CM. The fungus is found in soil all over the world. It's usually found in soil that contains bird droppings. Applications in medicine. It usually manifests as picture of chronic meningitis of several weeks of evolution, with headache, fever, lethargy, sensory and memory deficits, and even visual impairment, paralysis of cranial nerve or skin manifestations. The fact the classic signs of meningeal irritation as well as the duration of the clinical picture are part of the differential diagnostics with bacterial meningitis, which is usually more acute or florid.
Today we will discuss meningitis. Let's see what it is. Meningitis occurs globally, but is worse in some places than others. This disease is very serious and can kill. However, it can be treated so that people do not die. Meningitis is inflammation of the meninges, which are the covering of the brain and the spinal cord. It is most often caused by bacterial, viral, and fungal infection. This disease is common in children, and it may begin as complication of other diseases, such as measles, mumps, malaria, or even as an ear infection. Community health workers, parents, and carers can all play a role in reducing the number of deaths caused by meningitis. It is important to look for any of the following signs, particularly in infants and children, but remember that meningitis can also affect adults. A high fever is a common symptom and can be accompanied with vomiting, severe headache, and a stiff neck where the child looks very ill and lies with his head and neck bent backwards. In babies less than 1 year old, the soft spot on the top of the head, known as the fontanelle, may appear swollen, known as bulging fontanelle. Sometimes a child suffering from meningitis may also experience fits or convulsions. At the late stage of meningitis, a rash may be visible on the child's skin. If you have a glass available, it is possible to do the tumbler test. If the glass is pressed firmly against the rash, it will not fade and will remain visible through the glass. If this happens, you must seek medical advice immediately. But remember, you must also be aware that a rash does not always appear in a sick child or adult. Sometimes early meningitis can be hard to recognize, but the child may also cry in a strange way, even when the mother puts the child on her breast for feeding. The child may be unusually sleepy and unresponsive. Often the children get worse and only become quiet when they lose consciousness. In other children and adults, you may notice that they dislike bright lights. Not all of these symptoms will appear. Even if just one symptom appears, you should take the situation very seriously and act as soon as possible. Remember, meningitis can kill. Treat appearance of any symptom very seriously and seek medical assistance immediately.
Pros and cons. Regarding the treatment, amphotericin B causes many side effects, including damage to the kidneys, high fever, low blood pressure, decreasing the number of red or white blood cells, nausea, vomiting, and chills. A new formulation of the drug in which the active compound encoded with a fatty substance is being studied and may have fewer side effects. However, more research is needed to determine the risk and efficacy of new form of amphotericin B. Flucytosine can also cause serious side effects such as the decrease in the number of red or white blood cells, liver damage, nausea, diarrhea, cirrhosis, abdominal discomfort, and skin rashes. Fluconazole causes fewer side effects, and these are less severe, including skin rashes and liver enzyme abnormalities.
Hello, this topic is encephalitis and meningitis. Encephalitis is an inflammation of the brain, and the meningitis is an inflammation of the membranes that surround the brain and the spinal cord. Both encephalitis and the meningitis can be caused by bacteria or viruses, and they are rarely fungus or be non-infectious. So which means that most of the time they are bacterial or viral infections, and the causes are infection. Now the headache and the fever are the most common symptoms of the encephalitis and meningitis, and the stiff neck, confusion, and the lethargy can also be present. Now the diagnosis is usually made by performing a lumbar puncture or the spinal tap test, so which the doctor will take a fluid from the spinal cord and send it to the lab for the test. Now the doctor may advise the imaging tests like a CT scan and MRI of the brain, and can also be helpful. And usually it's done in addition to the spinal tap test. And the treatment depends on identifying the underlying cause. If the bacteria is causing the infection, then the antibiotics are indicated. But anyone experiencing symptoms of encephalitis or meningitis, you should see a doctor straight away. Now the basic methods to prevent the spread of the infections can help to prevent the spread of some of the forms of the meningitis. And you can do that simply by washing hands and covering one's mouth and coughing. So by just taking these simple actions, you can protect others. Being current on vaccinations will help to prevent certain forms of meningitis too. Thank you very much for watching this video. If you need more information about encephalitis or meningitis or any other medical condition, you can visit our website www.diseasesandtreatment.com. Thank you very much.
Issue of wine in Ecuador. Describe infection due to Cryptococcus spp in patients with HIV/AIDS from Guayaquil, Ecuador. 18.02% of the patients included in the study were male, or 45.12% were in the 20 and 30 years age group. 33% had infection with Neoformans, and their most common clinical feature when diagnosing impression of neuroinfection: headache, vomiting, weight loss, CD4 counts, leukocytes, and hematocrit. An association was also found between infection and the presence of vomiting, weight loss, and adenopathies.
देखो सलाम करो सलाम करो सलाम करो जल्दी जल्दी सलाम सलाम करो जल्दी इधर देखो जल्दी सलाम करो
Conclusion: being of fungal infections more frequent, and taking consideration what potential immoral that can become safe pathology, is important to know the diagnosis and management of patients with meningitis cryptococcal, in addition to need to update constantly for better board.